Charles is fine.
I'm sorry.
Good morning. I'd like to call the August 2nd, 2021 meeting of the Cumberland County Board of Commissioners to order and welcome everyone. At this time, I would like to ask Commissioner Michael Booth if he would do the invocation followed by the Pledge of Allegiance.
If y'all just bow your head for just a moment. You can see that I actually have one written. I'm a Northern Catholic, and I can't do that. Southern Baptist, thankful for everything. And I was going over here with Dr. Stewart, and she said, how many preachings is that? And I said, okay, never mind. She said, just do it. So, good morning, Lord, and thank you for another day of life. May you give us the strength to make decisions not just for ourselves, but for everyone. Everyone that has supported us and trusted us to make decisions for them should be upmost in our mind. Our city, state, county, and world are going through very troubling times right now. Please help those who make these decisions to make the best ones for us. And this morning on social media, right before I came here, there was one on there that said, I've got to get my life in order. This past week has shown me that I can't spend eternity in hell. So with that in mind, please keep us safe. Give us the opportunity to receive your blessings today and forever. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, sir.
Is it me? It's Polish, please.
At this time, I would like to ask the Cumberland County Animal Service to join me at the podium, please. The mission of the Cumberland County Animal Services Department is to protect our citizens by active enforcement of state and local laws, provide for the human sheltering and outcome of stray and unwanted animals, and promote responsible pet ownership. The primary objective of animal services employees is to provide excellent service to the citizens while dedicating themselves to improving the welfare of animals and humans. I am pleased to announce that the Cumberland County Animal Services Department has been recognized with the Transformational Change Award from Best Friends Animal Society, a national animal welfare organization dedicated to ending the killing of dogs and cats in America's shelters. The department received the honor for having the largest improvement in their live release rate, the number of animals leaving the shelter, and a positive outcome for shelters in taking 2,000 to 10,000 animals per year. Animal Services is a member of the Best Friends Network, which comprises more than 3,300 animal shelters, spay, neuter organizations, and other 501c3 public charity rescue groups across the country working to save the lives of dogs and cats in their communities. The department was selected for the Transformational Change Award based on national shelter data and work from calendar year 2020 compared to 2019. National, state, and shelter level data can be found on the Pet Life Saving Dashboard published by Best Friends. Please join me in congratulating the Cumberland County Animal Services Department on this recognition. At this time, I would like to ask Ms. Smith, the Director of Animal Control, if she has any comments, or anyone else. Wait a minute, hold up. Well, if not, congratulations, and we appreciate everything that you're doing in Cumberland County to help the citizens know about animal services. Thank you so much.
Commissioner. Thank you.
You sure you don't want to say no?
Sure, I'll say something.
Okay.
I will. Sure. I do want to recognize Dr. April Kelly, who is our shelter veterinarian and has had a huge role in improving our life-saving numbers. Basically, we have vastly reduced the number of animals we're euthanizing in our shelter. And Dr. Kelly's efforts with our trap, neuter, release program for cats and other measures have really had an enormous impact on that. Also with us here today is Kimberly Blue, who's our customer service supervisor. And of course, a lot of what we do is communicating with the public about animals. So her staff is the ones who make sure that the citizens get the information and the help that they need. So thank you very much.
And I was going to try to catch you before you left. Commissioner and Council has a comment.
Yes, Mr. Chairman, I've had the opportunity to watch animal control grow and develop over the past few years. It is amazing the progress that you have made. It is just fantastic. And I wish you could see it through my eyes to see it develop. And especially, this is not Women's History Month, but especially to see 3 women up there. Sorry, guys, I'm sorry. But we have had some hard times in Cumberland County when it comes to animals. I am an animal lover. I also hate those cats that walk on my car. I take all comments and everything. You have an extremely hard job. No matter what you do, there's somebody that you're not going to satisfy. But if you ever want to talk history, I can go back a few years and a few administrations and tell you some things to make you even more proud of yourself. I am fantastically proud of you all. Thank you.
Are there any other comments? Thank you, Commissioner Council, and again, congratulations to our animal service team. And you know what? And I agree with you. But thank you for taking time out to come. Madam Manager.
Yes, sir. Good morning, Mr. Chairman and Commissioners. Before we get started, I just wanted to tell you that the Budget Department set a goal of having the budget document and the budget in brief ready and finalized for you this morning. So we've placed this at your seat this morning. As you go out into the community, we'll have additional budget and briefs if you'd like to share those, but we just wanted to make sure that you had your budget documents this morning. Our first item on the agenda is approval of the agenda.
Is there a motion for approval?
Move to approve.
Second.
All in favor?
Unanimous.
Thank you. At this time,
Yes, sir. Item number 2 are our presentations. We added this to the agenda Friday morning with the increasing numbers from the Delta variant. We thought it would be timely to ask our Public Health Director, Dr. Jennifer Green, to join us this morning to give us an update. Good morning, Dr. Green.
welcome, Dr. Green.
Over there. Here he comes.
Get them into fixed time.
Good morning, Commissioners.
Good morning. I'm sorry about that.
No, that's okay. Thank you. As Ms. Cannon mentioned, we've seen an increase in our cases, not just here in Cumberland County, but across the country. And so thank you to Ms. Cannon for allowing me the opportunity to share with you an update on our numbers, some of our testing and vaccination efforts, and the status of what that looks like in Cumberland County. So we'll start with the numbers. In the last 7 days, and we pulled this data down yesterday, we've had 818 cases in the last 7 days. We haven't seen numbers like that for several months now. In the last 2 weeks, we've seen over 1,400 cases. So if we do the math, we are having more cases week over week in comparison to the prior week. We've had 330 deaths in total throughout the pandemic, and we'll talk about who those individuals are in just a moment. Our case positivity rate has increased to 15%. Again, that recommendation from the World Health Organization is 5%. We haven't seen a 15% case positivity rate for several months now, probably since the holiday season of 2020. Our hospitalizations are increasing. All of our metrics are moving in the wrong direction. On the right-hand side of the screen, you'll see the North Carolina County Alert System. We had several months of being in the yellow or the light yellow, and we've moved back into the orange phase, which would indicate or substantial impact on cases. And then according to the CDC metrics, we are an area of high transmission according to the way that they calculate their metrics. So in terms of our vaccination data, there are really two sources of where to get vaccination data. The first is, of course, our state health department, and I'll get back to that in just a minute. But the big news over the last couple of weeks is the CDC data tracker. I know the commissioners and our local health department and our state health department have been pushing hard since the beginning of vaccinations to include data from Fort Bragg, the VA, and that data is now available, so that's exciting. The CDC a couple of weeks ago added that information to their CDC data tracker. And so according to their data tracker, we have 55% of our population 12 and older fully vaccinated. If we just examine the number of adults that are vaccinated, we have 58% fully vaccinated, or 58% fully vaccinated. And the number I'm really proud of is our 65 and older group. We have 82% of our 55 and our 65 and older group vaccinated. So we sometimes for our flu vaccines, we don't see numbers that high. So that is a really great step for our community to get more of our older adults vaccinated. We want those numbers to be closer to 70 or 80% of our population vaccinated. So while we've had tremendous efforts, we still have work to do to get more members of our community vaccinated. So again, those numbers on the left do include the VA, the DOD, Federal Bureau of Prisons, the Indian Health Service. On the right-hand side is a graphic from the State Health Department dashboard. We often get asked about how are we doing this equitably, and the State dashboard has metrics by race, age, gender, et cetera. And unfortunately, our State Health dashboard still doesn't include those federal vaccination partners, and that's, I know they're still working diligently to get that data imported, but the data fields don't match up quite the way we need them to. So the numbers on the right don't include Fort Bragg, the VA, the DOD, but we have about 25%, and again, this is going to be an underestimate, about 25% of our African American community is vaccinated, about 24% white, 17% American Indian, and those are the percentage of the population, and about 35% of our Asian and Pacific Islanders vaccinated. So we have some disparities that still exist, and we are working diligently to close the gap. So the big news, of course, in the headlines is all about the Delta variant, and last week the CDC issued some guidance along with our State Health Department and provided some very concrete updates about the Delta variant in terms of the science of what we know now. So the first thing is that we know is that the Delta variant spreads much more easily than other previous variants. This is, we've had several different types of variants of COVID, an Alpha variant, a Delta variant, et cetera. And this one, previously, what we call the UK variant, spread more easily than the original strain, and this spreads even more quickly than that, so twice as easily from person to person than other strains. This has become, by and large, the predominant variant in our community. People often ask me, did I have the Delta variant? I'm not sure. What our state officials have told us is, assume what you have is the Delta variant. More than 80% of our cases in North Carolina are the Delta variant. Assume what you have is the Delta variant if you do have a positive case. This has dramatically increased from May to July from less than 1% to 80% of our cases, and this is again evidence that it spreads so quickly in our community. When you are impacted by the Delta variant, you have more virus than other previous strains. So we call that your viral load. So not necessarily mean that you're more sick or it's more deadly, but you have more virus, which relates again to it being more transmissible. We often get questions about breakthrough cases, and we know that breakthrough cases are possible. Our vaccines are not 100% effective. So we know that there are going to be some cases, and those cases tend to make the headlines. So if you look at the news, you hear about a person that got COVID when they were already fully vaccinated, but by and large, our cases are among those that are unvaccinated. In North Carolina, 94% of our new cases and our deaths are among those that are unvaccinated. So yes, breakthrough cases will happen among those that are fully vaccinated, but that's not the big chunk of our cases. And again, that's a very small percentage of those that are actually passing on the virus. And nearly all of our, this is not just in Cumberland County, but statewide, nationwide, nearly everybody that is hospitalized and dying are among those that are unvaccinated. So in North Carolina specifically, we don't sequence right now, the Delta variant or any of the variants at the county level, so we don't have that data. Our state doesn't. They're working towards that. But again, we can assume that this is the most common virus circulating here in North Carolina and in Cumberland. So as a result of all of those things, again, much more contagious, most of our hospitalizations, most of our deaths are a result of this Delta variant. The CDC, and then following last week, the State Health Department issued some new guidelines about where we are moving in terms of our response efforts. So the first thing they noted was that recommended is that in areas with substantial and high transmission, and that includes Cumberland County, the CDC recommends and our State Health Department recommends that everyone, even those that are fully vaccinated, wear a mask in public indoor settings. The second recommendation was for universal masking for all teachers, staff, students, visitors in K through 12 schools, regardless of your vaccination status. Again, this is because of this much more transmissible Delta variant. And we are working with Dr. Conley and the school district to make sure that they have this guidance in front of them. The State Health Department has updated their toolkit to align with these recommendations, and the recommendations also align with some of our other national child organizations that have also issued guidance about masking in schools. The recommendation also encourages in-person learning for the fall. There's a slight change in guidance for those that are fully vaccinated. If you'll recall from a few months ago, the CDC said if you are fully vaccinated, you do not have to quarantine if you get exposed again, and that is still true. However, the slight change in recommendation is that if you are exposed and you're fully vaccinated, we still want you to get tested just to make sure you're not asymptomatic, and certainly if you have symptoms, we want you to get tested. And we want you to do that about 3 to 5 days after your exposure, and then we want you to continue to wear your mask. You don't have to quarantine, but we want you to wear your mask until you have that negative test result, and we just want to be sure that we are capturing all of those cases. So those are the big changes in guidance from our CDC and our State Health Department last week. So I'll talk a little bit about our vaccination efforts. We have received some at-home test kits from our State Health Department and we are working to make sure that the community has access to those. And so the at-home test kits, you can pick up a test kit. You still have to send it off to a lab. It's free shipping, but you do need to have an address to get your results back to, an email address. So you can pick up a kit, do an at-home test kit, or swab yourself, and then send it off and get your results in just a few days. So we've been starting to roll those out slowly. We have a limited supply right now, but for example, this past Saturday, we were at a community event, and we distributed some of those at-home test kits. We continue to vaccinate at the health department. You can do that every day, Monday through Friday. We strongly encourage everybody to get vaccinated. Many thanks to Ms. Faith Phillips and her teams at the library. In the last month, we have been rotating at the libraries on Saturdays in areas and census tracts that have the highest numbers of cases and the lowest vaccination rates, and the library staff helped us to identify some of those locations. And so we'll do that the month of July and then through the end of August. So many thanks to her team for helping. We've also, we are very close to the back to school, just a few weeks away. So we've been trying some innovative things to make sure that as families come in for their back to school immunizations, they also are getting their COVID vaccine. So this past Saturday, we had a back to school / COVID clinic where families could come in and get their vaccines for both COVID and for all of their childhood immunizations. We have been working diligently with the state vendor to OptumServe. We are getting back into the phase where we're getting more requests to come out to vaccinate than we can handle. And so we're working with the state vendor to help us cover some of those events. So they have been a fantastic partner. We are planning some vaccination efforts, with some of our college students and university students going to their orientation or their back to school events so that we can vaccinate them while they're on campus. And then the Healthier Together campaign is really a campaign and effort from our state health department, doing some on-the-ground grassroots work to knock on doors, get flyers out, tell people about their vaccination, and we've been coordinating closely with them to plan some additional vaccination events coming up in August. And then we know our young people are the least vaccinated, our 18 to 24-year-olds, and so the Fayetteville Millennial Council has been stellar in helping us to work on some of our messaging and our campaign materials and pushing that out locally. So I think that's my last slide. We want to urge the public again to get vaccinated. The state health department has rolled out a new campaign. Don't wait to vaccinate. As you saw from the numbers, we're moving in the wrong direction. We need people to take action now and not wait until they're hospitalized or severely ill to get vaccinated. So I will stop there and see what questions that you have.
Yes, Commissioner Adams.
I just have I only have two questions. One is that whether we can put this on the website and whether it's on the health department website for everybody to see, because I couldn't see some of the information way to the right. So I know that people get that.
Yes, we can, and we have a link to all of the dashboards, and actually we sent some edits last night, so we can get it up there. Oh, yes, we can, yes.
And if you go back, you can stay on that one. Just stay on that one. I think it's, for me, a little bit more information. I love the fact that 82% of the population 65 and older are fully vaccinated. But then if that's 82% and we're 55%, there's another age group that's not. I think for information purposes, we ought to know what that age group is, so because I think we need to push that age group in terms of those that are not vaccinated, because if you got 82% there are clearly some other lower age groups that's not vaccinated that we need to put a push on.
Yes, that's primarily those that are under the age of 30 are not vaccinating, and so you're going to see that some with our back to school efforts. We have some planned for Fayetteville Tech and Methodist, and we'll be talking with Fayetteville State to get their students. But we'll share that data out with you. It's our young people,
and those are the ones that's moving around the community.
And they're moving around the community.
Yeah. Not that the 65 and older are not moving around.
You're out and about. You're out and about as well.
They're not. Wait a minute, not me now.
Not you personally. Our older adults are out and about, but yes, it's our young people.
But
yes.
I think it's important, because if you see where they are in the restaurants and all that, we know who's out. And so I think it's important to have the great information, but also have the other information so that people can make determinations of where they go and where they reside. And I think it's good for our department heads who know who's coming in the building, you know, that information. I think it's important to have that. Thank you.
Thank you.
And you did an
Commissioner
excellent
Keith.
job. Thank you.
Thank you. I have a couple questions, Dr. Green, and if I make some assumptions that I'm incorrect, please tell me. You know, we hear a lot about the breakthrough cases, but in your opinion, if you have the vaccine and you contact COVID, the symptoms are significantly less as a general rule, aren't they?
That's correct. We are seeing that if you have been vaccinated and you still get COVID, you're much less likely to be hospitalized, much less likely to die. So your symptoms are more likely to be mild and oftentimes asymptomatic.
Yeah, sometimes the media comes through and says, oh, they got COVID again and they've had it, and they act like they've got COVID again and they went to the hospital. It's not the case.
That's correct.
Okay. The recommendations of what I didn't hear you say was that a lot of these restrictions that we're having to go into right now are because people are not getting vaccinated. If everyone was vaccinated, then we wouldn't have near this problem that we have, correct?
You are 100% correct. We are moving in this direction because people are not vaccinated. We have variants, we have this reversal of trends because we need more people to be vaccinated.
Yeah.
By and large, it is those that are unvaccinated that are contributing to the higher case counts.
And, you know, I personally, for me, I used to say, hey, that's your decision, I appreciate it. I've been telling all my friends, you need to get the vaccine because the hospital has 18-year-olds and 25-year-olds and 30-year-old moms, and those are the people on respirators right now.
That's correct. We are seeing younger people getting vaccinated. I personally have an individual I went to high school with that is perfectly healthy and got hospitalized, and it is our younger people that are filling up our hospital beds and some of our older adults, but those trends are moving younger and younger. So
Yeah.
you're not invincible if you're 20 and unvaccinated.
Yeah, that's what I mean. So I have two last things. In your opinion, is this the apex, or do you believe this is going to get worse?
That depends on what our community members do now. So
Okay.
if we can get more people vaccinated, and we've seen an uptick in individuals getting vaccinated after they see the headlines and they hear the stories. We've seen more people get vaccinated, but that's going to depend on what we do now in these next couple of weeks, what it's going to look like in the fall. I won't try to predict, but we certainly could have a fall like we did last year with travel restrictions and other precautions in place, and we don't want to move. I don't want to move back there, but it's going to depend on what people do now.
Thank you. And my final question is, you mentioned that school is getting ready to start again. Has the school board contacted you on any recommendations, or is there any recommendations coming down from CDC about not only schools, but government facilities, healthcare places?
Yes.
Recommendations?
So we have been in contact with Dr. Conley and his team. We are set to do a presentation for the school board so they can make their decision here in next week. But we've met with them last week and the week prior to review the recommendations. The state health department changed course just a little bit late last week, so we'll meet with them again to make sure they have the updated guidance. But we have been in conversations with them about that. And the governor last week has issued in his executive order, his cabinet to either present their vaccination status or be subject to weekly testing. And so, of course, we've shared that with Ms. Cannon and are working to make sure that everybody's clear on what the recommendations are and trying to look towards what other health departments are recommending for their own staff.
Okay. Thank you, Dr. Green.
Thank you.
Commissioner Booth.
Thank you. Just two quick ones. You said that there was 313 total deaths?
3:30.
330?
Yes.
Okay, 330 total deaths. How many of those have been in the last 2 weeks?
We have had, I will have to get you the exact number. We've had at least 6 new deaths last week, and The week prior, we've had at least 4 new deaths last week. So the number of deaths that we're having is going back to, is increasing. Is increasing. We had a couple of weeks where we only had 1 death a week back in early May, April, and now we are getting back to multiple deaths every week.
Okay, and to clear up some questions and conspiracy theories I've been asked about, someone didn't just sit in a lab and create this Delta one that's been out there, but now it's just becoming more prevalent. I mean, it's not somebody else has now thrown another, test tube on the floor and it's gotten out and everything.
Absolutely not, no. We didn't create the Delta variant in a lab. This is a result of when viruses, for lots of different types of viruses, they tend to mutate. This is a mutation of the original strain. Nobody created this in a lab, and that's because as it spreads more quickly, it mutates. And again, the path forward to avoid those future mutations is to get people vaccinated.
Of the original strain, because then there won't be any opportunity to
Correct.
variant from it if it's gone.
Correct, right, exactly, correct.
Thank you.
Dr. Green, thank you. Any more comments? Thank you for your presentation, and for those of us that are listening today, we want to encourage you to do the steps necessary to prevent this virus from continuing on and doing harm to members of everyone's family, and just be respectful. Just be respectful of your neighbor and do what's necessary to keep yourself safe, your neighbor safe, everybody. And Dr. Green, thank you for your continued updates and presentations that you make to make sure that we're informed of what's going on here in Cumberland County. Thank you very much.
Thank you.
Madam Manager.
Yes, sir. Our second presentation comes to us today from Org Code. As you may recall, at your February planning session, the board set a priority of addressing homelessness. And the first step to that was to get an outside review to address the gaps in the services, survey the community, and then come up with a strategic plan. Virtually today, we have with us Ms. Cindy Crane from Org Code, who's going to provide the presentation. Welcome, Ms. Crane. We can't hear you.
Okay, I am in.
Okay, we can hear you now.
Excellent, thank you very much. Okay, well, welcome. I apologize for not being with you. Speaking of vaccinated people who get exposed and wait 5 days as recommended to get a test, I will get my results back this morning. But so it's my pleasure to be with you. I have spent the last little over 5 months with members of the community in helping and to facilitate the preparation and presentation of your 3-year homelessness strategic plan. So on background, to figure out how we began the process and learning the community's needs, we conducted a very comprehensive community survey where over 600 individuals participated. We did a brief survey of people who are experiencing currently unsheltered homelessness that was conducted by the Salvation Army Street Outreach Team. We conducted a survey of the homeless service providers to really understand those that do that frontline work, their perspectives on the homeless response system. We did many interviews with those individuals who have professional expertise in this space. I had conversations with several of you about this topic of great importance. We had group conversations, stakeholder meetings. We went over some of the different system components that exist in Cumberland County. In addition, my team, we looked at HMIS data, Homeless Management Information System data of people who will enter the system. We looked at HUD data, the National Low Income Housing Coalition data, census data, in order to get an understanding from an analytical standpoint of where you were, in addition to just the traditional annual point in time count of people experiencing homelessness. And taking all this information and producing a gaps analysis, then we took all this information, and several dozen individuals participated in a 3-morning, 3-session strategic planning retreat to finalize the strategic plan. So let's step back and look at what the community began to tell us in the very beginning. So we asked many questions. There were several open-ended questions, and it was with 600 people responding. There were over 40 pages of narratives to which that we put into topically to coordinate and organize the information. The most frequently cited need was in the space of housing, that there needed to be more affordable housing, that there needed to be more housing developed, that landlords need to be better engaged, and there had to be sufficient housing subsidies to make sure that people had long-term access to affordable housing and to be able to sustain their housing. Next was about, I called it system improvement, from outreach to emergency shelter, to the need for how we coordinate and provide some of these housing subsidies, that we wanted to make sure that there was efficiency, there was effectiveness, and that this really required cooperation and collaboration throughout the system of care from all the providers and different system players. There was a pretty strong feeling about shelter, that there needed to be more emergency shelter, more provision of services during the daytime to make sure that people had access to the tools that they need to return to housing and stability. Wellness was a significant topic. People saying people need access to health care, the level of mental health care and the access to that. Behavioral health care for those persons who are suffering addictions, and that the supports were there and that they were definitely made available, especially to those individuals where those issues were central to their experience in homelessness. Continuing to understand what the community needed, opinion on what was needed for the homeless response system and should be included in this plan. Just generally, they wanted to see a reduction in homelessness. They wanted to be able to visually see that people were actually leaving the system of care. Outreach, the presence of unsheltered homeless, the desire to see a reduction in nuisance activity and panhandling, these were of tremendous concern. Employment. People got it that if you are very low income or the income you have is not sufficient, even with a subsidy, that people needed an opportunity for meaningful employment in order to become self-sufficient and to maintain paying their rents. They wanted to make sure that there actually was a plan, that it was written down, and that it wasn't just a report that sat on a shelf, but that it was endorsed, that it was embraced, and they actually could see people working the plan. And then a general idea that there needed to be awareness. People really needed to understand the scope of homelessness, the complexity of homelessness, and to understand that there are solutions that are being worked today and that there could be some innovation for new solutions in the future. We also produced a gaps analysis, which you all received a copy of, that really looked at general from systemic to data to comparative information. And so I'm going to go over just a few highlights of that gaps analysis. This data that you see in front of you comes from a dashboard that is maintained by the North Carolina 211 system. You all can go out there and look at your county. One of the areas they pay special attention to are people who seek assistance with housing or emergency shelter. And you can see over the last 2 years, Cumberland County, this is in comparison to the counties in your state, ranked number 1 of people calling in needing assistance with housing and emergency shelter. And more recently, in 2021, Cumberland County was number 2 in this space of people calling 211 looking for assistance related to housing. We did an analysis of just comparing different continuum of care, which is that geographic reference that the U.S. Department of Housing and Urban Development uses to sort of categorize different communities that have efforts towards homelessness. And so when we look at some of the data specific to emergency shelters and unsheltered, Cumberland County, there highlighted in yellow, has a comparatively very high number of unsheltered homeless as a portion of all the people experiencing homelessness. 55% in the last point in time count of people who were found to be homeless were unsheltered. And you can see comparative to other communities where it's 14, 28, 12, 24%, that is exceptionally high. Now, we know that it may not be causation, but there was, without question, we know that there is correlation between emergency shelter services and availability and unsheltered homelessness. When we look at emergency shelter beds per 1,000 population, Cumberland County has a comparatively low number of emergency shelter beds. You can see 0.113 beds per 1,000 people of the population of Cumberland County with their 38 beds. And you can see these other communities, Raleigh-Wake, 509 beds, Asheville, 259, Huntsville, Alabama, 530, and you can see their proportion. So we know, and it was expressed throughout this process, that this community is well aware of the shortage of emergency shelter beds. Other components of the highlights of the gaps analysis is looking at housing. So what is our housing supply? We've looked at demand. What about the supply of housing that we have available? And using data that is organized by the National Low Income Housing Coalition, they use different extrapolations of both HUD and U.S. Census data to understand, and this is just North Carolina, to understand how many extremely low income renter households do you have in your community, and then how many available rental units are even available for that community. What we understand that Cumberland County has fewer affordable and available rental units for extremely low income households. The reason I focus on extremely low, because we know when we look at HMIS data and we look at the incomes and the size of households there, that nearly all people who are experiencing homelessness, unsheltered, in emergency shelters and transitional housing facilities, they almost all fall within extremely low income households. That's why we highlighted that. So you could see in Cumberland County, for every 22 individuals, there was, for every 100 individuals who were extremely low income, there were only 22 beds compared to statewide average of 45. And you could see in other communities. So again, Cumberland County is facing this shortfall in affordable and available units. Cumberland County also has a higher rent cost burden for extremely low income households. We look at the cost burden. Renters with a cost burden spend 30% or more of their income on rent. And for the severe cost burden, that's where at least 50% of their household income goes to rent. And you can see that though not the disparity between other communities is not as great for extremely low income, Cumberland County, of those extremely low income, they're 90%. When it comes to severe cost burden, 84% of those individuals, extremely low income households, have a severe cost burden. So again, we see how the supply of housing can put pressure on the community for people who are trying to go from homelessness to rehoused, the reality of the shortfall of units available. So those were just highlights of that. So we take the work that we did from the data, the gaps analysis, the survey information, and all the different interviews, and we came together with everyone having reviewed these facts for 3 days to work through and facilitate through the eyes of your community, your stakeholders, your experts in this space to develop the homelessness strategic plan. One of the things we wanted to make sure that the plan was really grounded in a common vision and a mission statement. So the vision, this was compiled through facilitated groups, excuse me, our system of care will meet the needs of all people at risk of and experiencing homelessness through a collaborative process anchored by our shared vision and priorities, and supported by an innovative housing-focused service delivery approach that is holistic, trauma-informed, and culturally competent. This is the vision for the plan, this is the way we want to see Cumberland County address the needs of people experiencing homelessness. And the mission, which is a mission that has been adopted by many, many communities throughout the United States and the federal plan to end homelessness, to make homelessness a rare, brief, and one-time experience in Cumberland County. So the homelessness strategic plan has been distributed and been reviewed by several groups. It is a simple document, purposely so, because there was a lot of input that said make sure we can read it, we can understand it, and that we can be able to act on it. The structure of the homelessness strategic plan is structured around impact area, taking all the needs and say, these are the key areas that we need to prioritize. Each of these impact areas has objectives. These are very specific, strategic, transformational needs for the system of care, and that they want to make sure that within those impact areas that they will produce meaningful change. There's also the inclusion of leading voices. These are organizations, providers, leaders, institutions that we know have expertise in the space of the impact area. They have the knowledge of the resources, they know what's available, they know what's needed, and they would be critical to include moving forward with the action steps to fulfill the objectives. And those action steps are literally like a to-do list saying over the next 3 years, these things, these actions we know will have great impact in the objectives that will meet our mission and help to fulfill the vision. So here are those impact areas decided. Number 1, access to assistance. This is about that front door to homeless. This is addressing the emergency shelter need. We want to make sure that the access to the assistance we provide is very housing focused, because we know housing ends homelessness. Permanent housing, a recognition of the scarcity of subsidy, the scarcity of units available, and the pressures of being severely cost burdened and how it impacts and creates homelessness. Wellness and opportunity. It's not just about finding housing, it's make sure you're connected to the opportunities for your household, income generating for your household, wellness when you need those critical supports, especially for the chronically homeless and those who are presenting with vulnerable and health conditions. And the 4th impact area, community investment, that without the collaboration and cooperation and community partnerships mainly needed to leverage, not just passing through federal dollars and calling that the system of care, but understanding that it takes a broad range of community investment, not just money, but time, expertise, and even reorganizing and rethinking service delivery. So within these 4 areas are objectives, and then I will quickly work through these. Access to assistance, the objectives. Coordinated entry system is working. It identifies the most vulnerable and makes sure that they have access to those permanent supportive housing, that the people with the greatest need get those highest investments, but we want to get it to scale. The Day Resource Center, understanding that people need a place to go, especially with the high rate of unsheltered homeless. We need to increase year-round beds to emergency shelter, and making sure that it's organized and matches the need. And currently, the need for emergency shelter bed for single individual men is of highest need. Housing navigation. You can't just putting people in an emergency shelter and so you see fewer unsheltered. That's not the objective. Shelter services should be designed to make sure that they are housing focused from day one. What's your housing plan? How are we going to get you back into housing? That the system is focused on reentry back into a stable, safe housing situation. Prevention and diversion, understanding that there's not that much of subsidies. We have to make sure that people, believing in their resilience, that we can come up with strategies to prevent and divert people from falling into homelessness. And making sure that even that street outreach, because it's going to take time to bring down that unsheltered rate to get shelter beds going, that even street outreach, people can successfully move from unsheltered homeless into housing. The second impact area is permanent housing. Generically increasing the supply of affordable housing, especially for extremely low income and very low income, because very low income are the ones that are the closest to possibly falling into homelessness. Strengthening the partnership with existing housing providers such as the Fayetteville Metropolitan Housing Authority. Providing quality housing-based case management to make sure when we take these very vulnerable individuals, put them in supportive housing, that they are fully supported with case management and those needs to work through those first 90 days that can be very, very vulnerable, to make sure that those exits to permanent housing stay permanent. Tenancy support. Once people, when going from one end to the other, are precariously housed, episodically homeless, they need tenancy support to really make sure that they can sustain their housing. Landlord engagement, We've got to figure out how to get more individuals willing to accept vouchers, emergency shelter vouchers, willing to enter into those types of contracts where there may be a third-party subsidy player, and to show that they're going to be supporting that individual, not just leaving it up to the individual who's housed and the landlord. Bridge housing, understanding that if the permanent supportive housing is not available today, we want to make sure the very ill, the chronically homeless have a transitional space as they heal, as they stabilize, and before they may move on to permanent housing. Wellness and opportunity, right? People are resilient. You have to believe in that, and you have to make sure that they have excellent access, not just getting a list of referrals, but actually having that hands-on capacity. So that's going to take up more partnerships. There are many faith-based communities, many providers who are in this space, and they need to coordinate and collaborate and make sure that those opportunities present. Continue to align mental health services, making sure they are connected to housing and they're accessible for the unsheltered who may present only for meals, those individuals who get into shelter, and working with street outreach. Care transition protocols, when people leave institutions, that they have access to care. People who go into inpatient treatment and then exit, but then exit into homelessness and without support. Provide opportunities for meaningful skill building and employment in order to they can long-term sustain their housing and transportation as part of a critical component to be able to be self-sufficient. And the community investment, several ideas that say we have this focus, but working together to have a focused grant writing resource that understands that homelessness is an important topic to this community, it's an important topic to the county, and that we're looking and we're focusing on any opportunity. Communicating to businesses and organizational leaders that we have to educate them and ask them and have them champion some of these opportunities, especially within wellness and opportunity. Professionally staffed the continuum care. The continuum care is a volunteer-run nonprofit organization with no full-time staffing, and so the challenge to be able to provide all these results from a part-time volunteer staff can be challenging, and it can be concurrently very well supported by the county at serving as collaborative applicant and the HMIS provider. And developing the marketing messaging strategies so the community is buying in. There were some individuals in the community survey, they see a couple of homeless people unsheltered, they've seen them this month, next month, the month after, and in their eyes, not aware of the system of care, they think no one is doing everything, when in actuality, there's a great deal of work that has been started. There are foundational investments that have already been made in Cumberland County. And so it's important not to just have a report on a shelf. ORCODE helped to design some very simple ways to do quarterly progress reporting. You want to make sure that, okay, here's what we said we were going to do for access to assistance. Here's the number of action steps for permanent housing. And just to even say, where have we taken action, where have we started and we are now in progress, and when we completed any action step, and providing a simple summary. That just to know that there is work to be done, not to be too complicated, but to understand that this is a meaningful strategic plan. And data does matter, and with the tools of HMIS and other information, very simple numbers. If we're going to make homelessness rare, then I want to know how many people are becoming homeless, that it's brief, how long have they stayed in homelessness, and that it's only one time of the individuals coming into the system. How many have been homeless before in the last 2 years? And just making very simple numbers, quarter to quarter change, so that we can identify progress, or we can identify where we're not making progress and taking action. So next steps, it can be, so we got the plan, now what do we do? Community review and endorsement of the homeless strategic plan. Some people adopt, some people endorse, some do a general resolution, say we accept it. In other words, we recognize that our community created this document and it has meaning to the community. It may be important to identify the leading body that's going to guide the implementation, not be responsible for every objective and every action step, but that they will guide, they will pay attention to those quarterly reports and monitor the progress and talk and have communication with leading voices to see where they're going. and to determine what the priority objectives are for year one, and what specific objectives do we really think we can make meaningful progress on. Seeking the input from all the leading voices, begin planning, organizing, and taking action. And here I would say, when I think about communities that were successful after going through the process of coming up with this plan, it's when everybody can look. When I say everybody, local government, continuum of care, faith-based community, business communities, neighborhoods, churches, hospitals, criminal justice system, that they can look at it and they can see themselves somewhere in their plan, something that they can contribute, have impact on. Those are the communities that move forward, and to make sure that it is a shared plan for the community. So I really appreciate the opportunity to work with your community, and now I'm open to any questions and comments.
Are there any questions, comments on the report? If not, I appreciate you and this report. This has been, we've been waiting to hear that for a good little while now. And what it did do, it showed us what we already knew, is that we need to do something about emergency shelters as well as housing here in Cumberland County. To me, it's disappointing to know in 2020 and 2021 that we were ranked at the top of the list and not providing services for individuals that are not as fortunate as others. I think that when individuals look for a place to stay or come to work, they look at the way that that particular city and county is treating the less fortunate. And we have a group of good people here on this board, and I really do appreciate that report. And saying that, I believe we're going to do what's necessary to correct this ill. Thank you so much. Is there any other comments? Okay, Madam Manager.
Okay, so Mr. Chairman and Commissioners, this is a lot to digest in a short period of time, and I would suggest that we bring this back in an agenda session for further discussion and consideration. And as you consider it, our recommendation is that we seek the assistance of Org Code to help us with an implementation plan if the board should desire to move forward on some of these action steps.
Okay, Madam Manager, implementation plan. What would that consist of?
I think that I would probably need to have a little bit more discussion with the Org Code.
Okay.
I think we need a written plan, but I think the board would need to prioritize with the Org Code the next steps in what's been laid out today.
Okay. Okay.
The next item on the agenda is the consent agenda.
Thank you, Madam Manager.
He just
Okay,
did it.
Commissioner Keefe.
Yes, I would like to pull item 3I. And if there's no one else to have any items to pull, I'll recommend approval of the consent agenda with the exceptions of 3I.
Is there a second?
Second.
All in favor?
Unanimous.
Madam Manager, is anybody here that can talk about this?
We have the finance director as well as Ms. Jackson.
Okay. Not a problem. Thank you, Ms. Jackson, for coming. First of all, there's no doubt that security services are needed. I was a little taken back as I was looking at it, that the two lower bidders, they were called non-responsive, but because they left out something, but significantly less in cost. And one of the things says vehicles not mentioned. I do happen to know that one of the vendors is a local company that has a whole fleet of vehicles. But the difference was almost $50,000, which is my 30% more. Were these other companies contacted again, or did we just say, oh, you didn't do it, and that was the end of it?
That's going to be a
So that's a
finance
bid question. Mrs. Evans will answer that question.
Good morning.
Good morning.
So in following our standardized bid process, we conduct a fair and competitive process, and so the attachments that are required for everyone. And so in doing so, we would not make contact with the company to keep it fair and competitive.
All right. All right, we're talking about a $60,000 difference, and I understand that you put this policy in, but I don't understand why you would not consider someone, because they didn't mention something, that you didn't consider them when it may have been implied that it was there. I don't want to use the words I want to use, but I think you took the easy way out. There should be some contact with the company if there was an issue of that magnitude. I mean, we're almost 40% more on a big contract. $50,000 means a lot to me. And all right, you've given me your answer. Thank you.
Okay.
Any more comments?
Mr. Chairman, I would move approval of the formal bid award for the DSS Security Officer Services.
Thank you. Is there a second?
Second.
All in favor?
Voting in favor, Commissioners Lancaster, Council, Chairman Evans, Commissioners Adams, and Commissioner Stewart. Voting in opposition, Commissioners Keefe and Booth.
Okay, Madam Manager.
Yes, sir. That brings us to item number 4, our items of business. 4A is consideration of incentives agreement for Skyrim LLC. I'll ask County Attorney Rick Moorfield to present this item.
Welcome, Attorney Moorfield.
Good morning, Mr. Chairman, Commissioners. This matter was brought back as not in business because there is a change from what was advertised and presented to the board at the public hearing in terms of the clawback provision. A clawback provision is required by law in these agreements. What it means is if the company doesn't do what it's supposed to, then the county either stops paying incentives or can recoup monies that's already paid out. What was advertised and discussed at the beginning of this process was a clawback of 70% of the construction cost. In other words, if the company started a building and didn't finish it, the county could elect, you wouldn't have to, but the county could elect to buy the land back at the purchase price and buy the building back at 70% of the cost. The company came back when they wanted to do the agreement put into writing with 75% of all the cost. That's the only change that is different than what was advertised for the public hearing. With that said, again, because of the nature of this transaction, which is selling the properties that have been there since the 80s, it's still my recommendation that the board move forward with this agreement as is. The clawback is still there. It would just cost more if the board of commissioners elected to buy the property back in the event the company did not build the buildings. And I'll try to answer any questions.
Any questions or comments? Do I hear a motion? Yes, madam.
And before you make the motion, and one thing also, in further discussions with the company last week, if you make a motion to approve this, I'd also ask that you include with that you authorize the county manager to sign the deed and any other documents necessary to close these transactions.
Commissioner Council.
He just stated my motion.
Okay.
Thank
Is there
you,
a sec-
Commissioner Council.
Is there a second?
Second. Oh, Commissioner
Okay.
Stewart.
All in favor?
Unanimous.
Thank you, Board.
Thank you, sir. Madam Manager.
Yes, sir. Item 4B is consideration of grant award for the Connecting the Last Mile Digital Inclusion and Navigation at the Cumberland County Public Library. It also includes approval associated budget ordinance amendment B 22633. And this morning, we're joined with our library director, Faith Phillips, to tell us about this grant opportunity.
Oh,
Welcome,
can
Faith.
approve it.
Good morning, Chairman
Good morning.
Evans.
How you doing?
Good morning, Commissioners.
Good morning.
Good morning, County Manager Canley, Assistant County Managers, and other members of the Cumberland County team. I'm here this morning to ask you for consideration of a grant award for the project of Connecting the Last Mile, Digital Inclusion and Navigation at Cumberland County Public Library and approval of the associated budget ordinance amendment. I'm going to move this down just a tad. There we go. So the Connecting the Last Mile is an award of $95,846 from the State Library of North Carolina through their ADAPTS grant initiative. This is no match required American Rescue Plan funding that has been awarded for this fiscal year. Connecting the Last Mile is a project to enhance digital equity and access for our community members. The project's going to fund 2 staff members, 1 full-time and 1 part-time, to serve as digital navigators. Digital navigators are crucial in ensuring equal access to the digital world. While providing access to technology like hotspots and computers, as well as the internet, it's crucial for our community. But that access means nothing if a community member does not know how to navigate the digital ecosystem. These navigators will be dedicated to working side by side with community members to help them gain the skills, knowledge, and confidence to do what they need to do online, whether it be applying for a job, housing assistance like we just talked about, engaging in their students' online school materials, applying for benefits, and the list goes on. At the library, we've had a number of customers who have needed help with these types of items. And of course, we help them, always. But oftentimes, the library staff member is on desk. They're helping other people. They're limited in their time, and they can't sit down and provide the necessary reference. And that's what these staff members, these navigators, will do. Furthermore, Connecting the Last Mile is an initiative rooted in community engagement. Navigators will spend their time out in the community, meeting customers where they are, in order to break down other barriers of folks who may not be able to come to the library. As you see in the agenda packet, we have established partnership letters from Cindy Black and the Public Defender's Office, as well as Justin Hembry from Workforce Development Board. We have also had partnership conversations regarding the use of the navigators in the community with Veteran Services, Dr. Connolly at the schools, as well as the Housing Authority. In partnership with these agencies, the navigators will be able to go to these agencies, go to these offices, and work with their customers there to help them navigate items online that they need to be successful. The goal of Connecting the Last Mile is to instill in community members the skills and confidence needed to be successful in the digital sphere so that they can have truly equitable access. The project will also fund tables and chairs and other mobile items as needed. So in conjunction with the 100 hotspots we've already gotten for free from the State Library in another initiative, that we'll be able to be truly mobile and COVID precautions outdoor classroom where we can go beyond the walls of the library and meet customers where they are. Thank you for your time this morning, and thank you for your consideration of this award and budget ordinance amendment. I can ask any questions that you may have.
Are there any questions or comments? Oh, I'm sorry.
No, I don't have a question. I was going to make the motion, but Mr. Booth, you got a question?
I would just urge all of our commissioners to support the Glenn Adams amendment.
Well, I'm not going to say anything about how many commissioners up here had a navigator come up this morning, so I ain't going to say anything, Mr. Booth.
Are there any more questions or comments?
Mr.
If not, Commissioner Adams.
Thank you, Mr. Chairman. I would move that we accept the grant award for the Connecting the Last Mile Digital Inclusion and Navigation and approval of the associated budget amendment ordinance amendment B, number 220633. And what a wonderful job the library has done doing this. Thank you so very much.
Second.
It's been moved and properly second. Is there, call for the vote? All in favor?
Unanimous.
Thank you.
Thank you.
That brings
Madam
us,
Manager.
that brings us to item number 5, and these are your nominations.
Okay, we have one vacancy for the, Commissioner Adams. Would you take care of this for me, please?
Mr. Chairman and fellow board members, and I think Mr. Keith brought it to my attention, and I think we may need to at least address it maybe at the agenda session and talk to staff about how we do this. But if you look at all of these nominations today, every one of them had people who resigned from these boards, and we ought to know why they're resigning. If it was one particular board, but each one of these different boards had people who were resigning and we were reappointing. I think maybe we need to relook at that structure or determine or have some input as to why people are resigning. Could be COVID, could be a number of other issues, but just to have from each one of these different, the Board of Adjustment, Transportation Board, and the Joint Appearance Board, that we're replacing people who are resigning. I think that's a question that we may need to ask ourselves. But to the Board of Adjustments, there are 3 vacancies. The recommendation is Kenneth Turner as an alternate member. Recommendation for current alternate member who's been going to the meeting, Robert Davis, to become a regular member, and a recommendation for current alternate member, Linda Amos, as a regular member. That would be those nominations for the Board of Adjustments.
Okay.
The Transportation Advisory Board, the recommendation for Deborah Kinney for the at-large representative category, and Randy Hume for the urban transit provider representative category. And if I'm not mistaken, and maybe the clerk can help me, an email went out to us as commissioners to have a commissioner needed to be on that board?
That was.
The Transportation Advisory Board?
Not to my
That was a
knowledge.
different one?
Yes,
Okay.
sir.
And the Joint Appearance Commission, there was only one recommendation, and that was Kenneth Rogers to fill one vacancy. There's 2 vacancies. I don't know if anybody else has another, or if not, we can put it back on for the next meeting in August.
And Commissioner Adams, let me ask you this, back up at Senior Citizen Advisory Commission,
sorry.
and we do,
Where we at?
we have one vacancy.
Oh, thank you.
He just had a
I
senior
went
moment.
down there.
He had a senior
But
moment.
that was, okay, let's finish, we'll finish the Joint Appearance Board. We can bring that back in August for the second one, if nobody else has one. And I had the senior moment, right?
Yeah,
Mr.
senior
Booth?
moment.
The Senior Citizen Advisory Commission had one vacancy. The recommendation for that was Simonia Ross, Shamona Ross. I apologize if that was.
Thank you, Mr.
correct.
Vice Chair, and if you could continue on with the appointments, sir.
We got the appointments, the appointment of the chairman of the ABC Board. I think they voted on that, and they recommended Paul Crenshaw as the chairman for the 2021-2022 year. I'd ask for a vote. All those in favor? Oh, I guess I need a second. Mr. Booth?
Second.
Second.
All those in favor?
Unanimous.
And that takes us to the jury commission vacancy. There's one. The nominee is Scott Flowers. I would move appointment of Scott Flowers to the jury commission.
Second.
All those in favor?
Unanimous.
And we have an election for the ABC Board. There's one vacancy. The first nominee would be Harold Lee Bachman Jr.
I'm sorry.
Oh,
I'm
I'm
sorry to interrupt you.
No, go ahead.
The second name, we can pull that name.
Okay. Thank you, Mr. Chairman. That was his nominee. So that leaves us with one vacancy for the ABC Board. All those in favor of Harold Lee Bachman Jr.?
Is there a second, please?
Second.
Second.
Thank you.
Well, listen.
That vote is unanimous.
Just the appointments, you don't really, but anyway. And that concludes that, Mr. Chairman.
Thank you, Mr. Vice Chair. Are
You're
there any other comments at this time from the board? Madam Manager, is there a closed session?
No, sir.
Okay, no other comments? Motion to adjourn.
Move to adjourn.
Second.
All in favor?
Unanimous.
Thank you for a fantastic meeting, board.
Please give me, who's working with this thing?
William,